Well, all right. Well, good afternoon, everybody. It is 5 o'clock, and I think we're going to go ahead and get started. This is Stephanie Hall, and I'm with the ESRD National Coordinating Center. Just want to thank everybody for taking time out of their day to join us today for this professional educational Quickenar. This event is held in partnership with the Centers of Medicare and Medicaid Services. This call is being recorded and will be posted to the NCC COVID webpage within about 72 hours, if not sooner. So I do want to take just a moment here before we get into some other announcements into the presentation, just to let everybody know that starting August 5th, which is believe it or not, next week, we will be moving these webinar events to a new time, and we'll be going to a new schedule. They will, starting August 5th, and they will be going to every other Wednesday, and the time will be extended to 1 hour. We will be offering CEUs for the professional events, and the new time will be from 3 p.m. to 4 p.m. Eastern Standard Time. And also the patient-focused events also will be changing. They will be starting on August 11th at 4 p.m. They will also go every other week starting on August 11th. So what is the agenda? Here's the agenda looks like today. And let's take a look at it. So we're going to have an expert speaker is Dr. Janice P. Is with the Emory University School of Medicine, is the Chief Medical Director of Emory Dialysis and serves as Director of Telenephrology. Today's topic is something that we feel is important. We're going to be discussing myths and facts about COVID-19. For some of you who have been on our Quickenars before, this is going to be a little bit of a different presentation. We're going to be asking Dr. Leah some questions and asking her opinion on myths and facts. So we're going to be going through that here just shortly. As we go through the presentation, if you have questions, please submit them using the chat feature through WebEx or on the Q&A on the lower right hand of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with Dr. Leah. And of course, our goal is to answer as many questions as the time allows. So what's this call about? Our webinar events offer you the opportunity to hear tips from coping in a COVID-19 environment. We're going to learn about real-world experiences that you can put to use and share with others and engage with the calls on various topics. Now I would like to introduce our speaker for today. It's Dr. Janice P. Dr. Leah is a professor of medicine at Emory University and is board certified in nephrology and hypertension. Dr. Leah's research and clinical expertise are in hypertension, chronic kidney disease, kidney health disparities, and dialysis. She is a nationally renowned expert in hypertension, designated a clinical specialist in hypertension by the American Society of Hypertension. Dr. Leah also is designated a master clinician by Emory School of Medicine and serves as the director of telenephrology at Emory since 2017. Dr. Leah also serves on the board of directors for the American Association of Kidney Patients. So welcome, Dr. Leah, to our Quickenar this evening.
I'm glad to be here.
Good. So we're going to just start right in here. Like I had mentioned, this is going to be a little different feel from the Quickenars that we've had in the past, but we're going to go right into talking about separating myths from facts. So our first question to Dr. Leah is, if you are symptomatic, should you be tested again after knowing someone you have been in contact with has tested positive for COVID-19?
Yes, that is an excellent question, and my answer is yes, because, as we all know, there is some reports of patients possibly being reinfected, and or the immunity, if you did have it before, the immunity, we're not sure how long that immunity lasts. So if you've been around someone that is known to be positive And especially if you were not wearing any type of face shield, if you came into contact with them, didn't wash your hands afterwards, etc., yes, you should be tested, because we know that one of the biggest problems with this virus is the asymptomatic spread of people not being aware that they had it, didn't have symptoms, but still spread it to others.
Great, great, thank you. So the next question is, not everybody is wearing masks correctly or recommending when to wear them consistently. My doctor recommended wearing a mask at all times, even when walking outside or driving. When should a person wear a mask, and what is the proper way to wear one?
Okay, another excellent question. Certainly we know that whenever you're in contact with individuals, especially groups of individuals, especially when you're not able to properly social distance, you need to have a mask on. Now, I would say if you're in your car and you're by yourself, there's really no one that you are protecting yourself from or protecting them by wearing a mask. But if you get into a car with other people, if you're getting into an Uber, taxi, etc., yes, wear a mask. If you go outside and you're just walking, exercise in your neighborhood or right outside your home, etc., and there's no other people around you with any close distance, I would say you would not have to. But any type of activity where there's people that are close in proximity to you, then yes, you have to wear a mask to protect yourself and for them to protect you as well.
Okay, great, great, thank you. The next question is, we know that COVID-19 is airborne and affects the respiratory system. We are told to cover our mouths and noses. However, our eyes are a gateway to our bodies. Are the eyes another pathway to possibly contracting COVID-19?
Yes, that is definitely true. In the healthcare setting where the nurses and doctors are taking care of COVID-positive patients, it's mandatory that they, in addition to wearing a mask and proper gowns and gloves, etc., that they do wear a face shield to cover their eyes or either goggles. So yes, there is a possibility that it can be spread through the eyes. Now, as far as the general public recommendations when you're going out, it's still just wearing a mask, washing your hands, and social distancing. But if you are in direct contact with someone who's known positive, then yes, you should have your eyes covered as well.
Okay, great, great. Thanks for confirming that. A face mask and a shield protects you from a person who is not wearing a face mask or a shield. Is that true or false?
I am going to say that is false. Yes, there is some protection. That's obviously why everyone is being encouraged to wear a mask and face shield if possible. However, if it's not complete 100% protection, so if the other person that you're close to does not have a mask on and they have the virus, they're talking or sneezing, coughing, you can still get the virus even if you have your own face mask. So that's why it's just, mandatory really for all people to wear a mask so that you protect others as well as protect yourself.
Okay, great. Okay, very good. Very good, thank you. Another myth from facts, can our pets develop COVID-19?
Yes, they can. It's very low risk. You don't hear a lot about this, but there are some cases where pets have contracted the virus, most likely from humans. I'm not aware of any pet-to-pet transmission, but I wouldn't say it's not at all possible. But certainly, if there's someone in your home that has the virus, and just like you're quarantining them to a particular area of the home, you should also keep the pets away from them because they can acquire it. But again, it's much lower risk.
Correct. Yeah, I know there's been some conversation about that on the news and in articles about that. So thank you. Let's see. Is it true that a person can get COVID-19 more than once?
Yes. There's been a few reports of this also on the news of people testing positive, either becoming ill, getting better, and then retesting positive later. Now, it is a little bit unclear if the testing was the issue, if the test wasn't adequate and that it, maybe had a false negative, and it really hadn't cleared. Those things are unclear. And also it's unclear how long, as I mentioned earlier, how long the immunity lasts. Is it months? Is it a year? Is it just weeks? And that's why there's going to be a lot of study around the antibody testing, checking serologies over time to see how long people have immunity, et cetera, and still have antibodies. But right now, I would not say that if someone had it, that they can never get it again. I do think that it's possible. We just don't really know the exact time frame yet.
Right. So a lot of unknowns yet with this virus. Yes. I know. Yeah, definitely. Okay. Kidney transplant patients are at a higher risk of developing COVID-19. Is that true or false?
Oh, that's definitely true. Any immunosuppressed individual, whether they have diseases that suppress their immune system, their elderly patients have a suppressed immune system, and particularly transplant patients who are on immunosuppressive medications are more likely to really get a variety of infections, viruses, bacterials, other atypical type organisms as well. So definitely transplant patients as well as dialysis patients are at higher risk.
Okay, great. Another true or false, and you will not catch COVID-19 if you are outdoors.
Okay, I think we know that's going to be false because we've heard some news reports of people being in crowded venues outside and still acquiring the virus. So again, in general, you would think if you're outdoors, you're not inside where, there's a limited space for ventilation, et cetera, that you might be more protected. And I would say in general that's yes, but if you're around a lot of people and very close to you and no one's wearing masks, then you're just as at risk as if you were inside your home. So or inside a restaurant where they're also not practicing social distancing. But if you can socially distance outside, wear a mask, I think that is better to be outside versus inside. But in general, you have to use the same precautions in both places.
Right. Very good. Okay. Very good. The long-term effects of COVID-19 include weak lung capacity and damage to the heart. Is that true or false? Or do we know yet?
Yeah, well, I'm gonna say we know from the acute illness when the patients are in the hospital, it's definitely affecting their lungs and their heart, amongst other organs as well, the kidneys, the blood vessels, the clotting system. It's affecting a variety of things. I think we don't know the sort of long-term effects yet, but we certainly know that there are some people who are still not back to their normal self after having and recovering from COVID. They may have some chronic shortness of breath. Some may still have a cough. I hear a lot about tiredness and fatigue. So all of those things, yes, can happen, but we don't really know the extent of how long this may happen. But short term, we have observed that.
Okay. Since I am elderly, if I had COVID-19, it would be more difficult for me to pass it on to my grandkids. Is that a true or false?
Well, this question is, I won't say it's completely true or false. It depends. So on exactly how you state the question. Yes, you can, if you're elderly and you have COVID, anyone in your family or that you're exposed to it is at risk. However, the risk is higher for the young person giving it to the elderly individual than it is for the elderly to give it to the children. But you still need to be aware that anyone can get this. We're hearing, more and more lately that it's affecting younger people. Mm-hmm. And even babies and toddlers. So yes, I would say that it is more difficult, but it's not completely that you can't give it to a younger person.
Okay, good. Okay.
Because the younger people's, in general, you would say that the immune system is better in younger patients than elderly, so that's why the elderly has always been focused on as the highest risk group. But again, all persons are susceptible if you're around anyone that has COVID.
Great. I do. Thank you for answering those questions, and then I have received some questions in through the chat and the Q&A. And before I get to those, I just really want to ask you a question myself, and just if you could, you're a nephrologist, and if you could kind of share with us some of your lessons learned from your experience to this COVID-19 pandemic as it relates to taking care of your ESRD patients.
Yeah, that was yes, lots of lessons learned. We, of course, in the dialysis unit, I would say is probably the area that was most concerning because of, these patients have to come to the dialysis unit 3 days a week. A lot of them have to get public transportation, etc., so they can't properly social distance. And in large clinics, the chairs are not that far apart. And so we had to really implement as best as we could in the environment that we were in to allow for proper protection of the patients as well as the staff. So we started out, originally when this all first started, no one was saying wear a mask, so we didn't do that right away, but eventually as it became clearer that should happen. So that was definitely a lesson learned. I would start with the mask immediately if this, happened again at some point. Really focusing on the patients who live in nursing homes because we, found that was a very high-risk group, and probably isolating them from the beginning because of their risk outside the dialysis unit. And just the toll that this took on everyone, the staff, the nurses, and the patients. And, we did lose a few patients to COVID. It was very upsetting for me because the patients were otherwise doing very well. Some had been on dialysis for years, some over 10 years, and, never were in the hospital for anything. And then acquired COVID from we think from a family member. And so that was another lesson, that even though we're doing everything we can in the clinic to optimize infection control, is to make sure that the patients understand at home that, one lady, her grandchild went to a high school that one of the teachers received COVID, and so that's how that person got it from. And so from the beginning, learning these lessons to make sure that they're properly isolating themselves at home when they have, even though they're staying at home, but their family members aren't, and they're out in society and coming home. I had a transplant patient that was the most upsetting to me. He was worried about getting the virus, and he wanted to stay home from work, and I wrote him an excuse for work. He did not go to work throughout the whole pandemic. His daughter was a healthcare professional, came home with the virus, or maybe she didn't even know she had it. He acquired it, and he passed away in it, which is very upsetting because he was trying to do everything right.
Oh, yeah.
And so really a lot of lessons learned, to what things to focus on, and tell the patients what to do at home to protect themselves as well.
Right. Great. Thank you for that, sharing with that. There's a nice question comes in, kind of follows up on that. It says, I would love to ask Dr. Leah if there is anything from her perspective that the networks can do to help facility staff and patients with coping with the HIV, with this COVID crisis. It feels like there's need to build up the resilience and the positive outlook across our community.
Yeah, that is an excellent question, and I've thought a lot about this. In addition to the patients, and I'll maybe speak to them second, I think the staff really need support. Because in the beginning especially, it was a lot of angst about all of this, and, the nurses still had to go and take care of the patients, and, they were really, really nervous and still are. And I think whatever type of support, I think the testing issue, I think if we could have testing of all the staff and the patients in the clinic, because that was one of the most frustrating things about this, was that if we did have a suspicion, and we sent the patient somewhere to get tested, the testing might come back, 2 weeks later, or they had to stand in long lines to get tested. And as we know, our patients aren't able to drive, a lot of them, to go to get tested. So I think having some type of, I was thinking of even some type of mobile units to come to the dialysis clinics to screen patients and staff. I know that that's something that would have to be in conjunction with the public health department, CDC, et cetera. But if the network could identify that as something that is a need, and work with those other partners to try to help support the staff and identify patients early enough, to get appropriate treatment and appropriate social quarantining measures in place.
Right. Well, that kind of segues into a question that popped in, and the question is, without a COVID-19 test, how can we differentiate the anticipated flu this fall from COVID-19?
Well, no, there's something There's something in that we are considering purchasing, and I'm sorry I don't know the name of it, but it is some type of testing. It's pretty, I think it's pretty expensive, but I think it's something that you can bill the patient for the test, where it'll test for for strep throat, it'll test for the flu, and it'll test for COVID.
Mm-hmm.
So I do think there's something that's going to be available, but the issue is the cost and, you know, that type of thing. But yeah, and if you could at least get the flu test in the clinic, and we were already looking at that to get that in our clinics, then you could at least rule the flu out if you don't have the COVID test.
Mm-hmm.
You know, and so then you know who needs to be sent separately to get a COVID test. But yeah, I've heard that there is something on the horizon to test all of those.
Okay.
In the clinic, and I do think that's something that is needed in dialysis. I mean, we do certain things in the clinic, but and we give vaccinations, you know, but I do think this type of testing it's important for infection control in the dialysis unit.
Great. I think we do have another question. I think we do have time, so I'm going to ask one more here. She asked, what if you had on a face mask and used hand sanitizer when you were exposed to a positive person? Should this group be tested also?
Well, it depends on if you know, the most proper protection for COVID and is going to be the N95 mask, and it has to be properly fitted. So just because you have an N95 and it's not properly fitted, you could still be exposed. So I would say yes, that person should be tested if they didn't have proper PPE.
Okay. All right. Good. Thank you. I do have one more, so I'm trying to get in as many of these as I can. If tested negative twice and being in quarantine for another 10 days, can I still be a carrier? The only symptom is a cough.
Yeah, that's the big unknown, and there's going to be studies looking at this to see how long the virus actually still sheds, even if your test is negative. I don't think we know that yet. You know, there are some recommendations from the CDC about how long after a positive test that you need to be in quarantine. I think, you know, not every place is repeating tests. You know, they're testing them, treating them, quarantining them, and they're not always checking to see if the test is negative. And so, you know, I've heard varying stories about that. I've had one nursing home patient whose test has been reportedly positive from the nursing home for 4 or 5 weeks. And so, and then others are negative after 2 weeks. So I think it's all over the place. So I wouldn't count on, any. I think we don't know for sure yet how long it will take to clear the virus, even if the test is negative. I mean, I think there's a lot more research that has to be done and following up of the patients.
Okay, well, great. I think we're going to go ahead and wrap it up. We're about just about a minute before 5:30. So, but thank you for answering all those questions. I think we covered a lot of the ones that were in the chat, so I appreciate that. I just want to take a moment to thank the American Association of Kidney Patients for their partnership with the development of this webinar event. The AAKP offers a variety of patient resources, including free membership. And this year, the organization is celebrating its 45th National Patient Meeting, which will be held virtually. Information about that meeting and other resources is on the screen. And for more information, you can visit AAKP at www.aakp.org. And I just want to take a moment to invite you to visit the new kidney hub.org. It's a secure, mobile-friendly web tool and was developed with direction from patient volunteers that has resources for patients and professionals. And it's the place to go for COVID-19 information, resources about home dialysis, infection prevention, and more. The goal of the Kidney Hub.org is to help patients and family members make well-informed healthcare decisions. Check it out today with your mobile device and then follow the directions from the menu in the upper right-hand corner of your screen to save it to your device's home screen. Just again, I want to, just as a reminder again, starting in August, which is soon, next week, these events will move to a new time and will last for 1 hour. The provider-focused event is scheduled for August 5th at 3 p.m., and our patient-focused event is scheduled for the following week on August 11th at 4 p.m. Eastern Time. You can visit the kidneycovidinfocenter.com for more information and to register for any of our upcoming events. We look forward to seeing you next month and invite you to share this information about the webinar events with others. Again, I just want to thank Dr. Leah and everybody for taking time out to attend this webinar today. And I just hope you have enjoyed the rest of your evening. And thank you again for attending.